Dr.Gunaseelan, former Dean, Namakkal Veterinary College, Tanvas, holds an MDSc in Veterinary Public Health and Epidemiology and PhD in Veterinary Preventive Medicine. Was the adjunct professor for large animal clinical sciences in Michigan University in 2012. His major fields of interest are in veterinary public health and epidemiology and veterinary preventive medicine, and that too in viral diseases, vaccinology, and helminth zoonosis. He owns many landmark works on the zoonotic tuberculosis, brucellosis, rabies, and zoonotic enteric diseases. His works endorse his interest in veterinary drug residues, AMR, and for the One Health approach. He has several of his works published in eminent journals like Journal of Advanced Veterinary and Animal Research and Indian Journal of Animal Research, etc. He was a co-principal investigator in many vaccine trial programs and trained programs to free veterinarians to augment their productivity. He was a principal investigator on the project of Crohn's disease in India. In this auspicious occasion, we are eager to hear from you, sir, welcoming you and your session on behalf of IVSA Pookode. Welcome you, sir.
Thank you. Now, Sarin, can you guide me once more on how to come back to the PowerPoint?
Sir, if your slideshow is on, you can simply press escape button.
Window.
Sir, have you shared?
Yeah.
Okay. First, you have to open your PowerPoint presentation. Make sure it's open. Then
is it entire screen or window?
Window.
Open a window. Okay, fine. I got it.
Give present now. Then select a window. Then select your PowerPoint window from that chat, that list.
Oh yeah, that's what you'd like to share, but my PowerPoint is not coming in. Okay.
Have you shared, sir?
Have you got it? I think it is there. Okay, fine. I got it. Is it okay now?
No. Yes, sir. Yes, sir.
Got it?
Yes, sir.
We are okay now?
Yes, sir. You can begin.
Yes, sir. Fine.
So, shall we go ahead or wait for some more time? No problem?
No, sir. You can go ahead.
Okay. So, first of all, let me congratulate Sarin and her large band of friends who have come out with this innovative movement, which is the International Veterinary Students Association. Very novel idea. And I think Pradyum Devaya was suggesting they were not able to muster up so many members, but Sarin was able to muster up 150. That is why Kerala is known as God's own country. It can muster up anything in the interest of, I think, societal well-being and things like that. So I must really congratulate the faculties of Pookode Veterinary College and of course the people who have advised you, Pradyum Devaya and Niti, member organizational director, who have guided you going for this kind of venture. Can I take a few minutes, Sarin, before I go into the talk?
Okay, sir. Sure. Sure. It's fine.
Okay, now these kind of movements or international veterinary associations are really going to be very important from the viewpoint of developing leadership qualities, organizational skills, interpersonal relationships, and things like that. Only one thing that I would like the International Veterinary Association Pookode to keep in mind is to see all efforts are taken with the help of your faculties and all your other friends to sustain this movement. That's the most important thing. When you come back here as faculties or when you come back here as a field service personnel, you must see that your endeavor has grown. Just like you see in that image there, you cannot, can you say whether it's a sunrise or the sunset? We cannot really say whether it's a sunrise or the sunset in my image there. But you see the glows there. So your association should definitely grow and grow. My best wishes to all of you on this. Thank you, the organizers, for having provided me this opportunity. And I will just start off with the talk, I guess. Shall I go ahead?
Yes, sir.
Welcome. So the first slide that I wish to show here is the most ambitious plan of the tripartite agreement between the World Health Organization, OE, and FAO. Very, very ambitious program they have charted out, and their hopes are very, very high. And World Rabies Day has really provided us the opportunity to know more and more about rabies, the importance, etc. And that's why possibly the strategic plan has come out. But in my personal opinion, this seems to be a very ambitious program. And we just got 9 years. We don't even have 10 years because 1 year has gone because of COVID. So in 9 years, we have to eliminate rabies. I think that's going to be a little tough. But you see, the thing is, as far as I'm concerned, now this could have been in the reduction of canine rabies rather than attempting to eliminate rabies. But you see, that's why I charted out this kind of title, where I have chosen the Mission Impossible. I'm sure you people would have heard of Tom Cruise's Mission Impossible movies. So I have borrowed that title here. Is conquering rabies going to be Mission Impossible or probable? So this is why I feel, but in every one of Tom Cruise movies, his assignments have been very tough and impossible, but he has made it possible. So in the hope that we can also make this possible, eliminating rabies, I go ahead with my talk. I hope the Malayalam part of the translation is okay because this was Googled. So, ladies and gentlemen, what I wish to say is we are just going to go through a few topics that are really going to show how challenging eliminating rabies is possibly going to be. So let me first begin with thanking the organizers first, and my faculties and students of the Department of Veterinary Public Health, the past, present, and the future, who have really helped me in collecting most of the inputs that I have here, most of the inputs that have been drawn from the works of many of my students. So I wish to acknowledge them before I go ahead. So going into the topic as such, you see, whenever we talk about rabies, many of us feel that we know many things about rabies, but there are certain things that remains unknown. That is why I classified it into acceptable realities and theoretical possibilities. You see, there are certain things which are already known. It's established. It's dog-mediated rabies, established. Rabies virus is neurotropic, neuroinvasive, and neuronal dysfunction. See, the most important thing about these three activities of the virus: neurotropism, neuroinvasiveness, and neuronal dysfunction. See, the most remarkable thing about rabies virus is it causes so much of what can I say? It causes a lot of death and a lot of clinical problems and things like that. But you see, the one important thing that does not do, it does not damage the neurons in any way. That is the most remarkable thing about rabies, and that is possibly why you find that immune responses are not very sufficient enough to take over this virus. In theoretical possibilities, there are several. People go about talking about dead-end host, can they transmit the virus? See, these are all theoretical possibilities. Some say the incubation period is 19 years, 2 years. See, these are not established as a matter of routine. That is why this is all put into theoretical possibilities. So that is why I say everything is known about rabies, but still there are things that are remains to be unknown. So the topic would be covering a small introduction of rabies, going into the dynamics of dog populations, a little bit about briefly on demographics of what we have exposed or experienced, and the spatial and temporal distribution in Chennai city. And next we go on to how to prevent the disease with vaccines and vaccine responses, diagnostics, and the spillovers, what can happen because of dog-mediated rabies. And we have devised certain algorithms which are now the fashion of the day, developing algorithms or modeling in order to predict something. So, and finally, therapeutic options that may be available to us in rabies. So let me just begin with rabies. This is the nidus. This is where everything starts. This is where dog-mediated rabies establishes itself, starts itself, and it's hiding, but it's hiding in plain sight. So we cannot see it, but it is there. So this is where I would say this is the beginning of the episode. So in this context, we need to know what are the different kinds of dog population we are exposed to. You all know it. So own dogs. I'm not going to be really concerned about own dog. I'm more concerned about community-owned dog and the ownerless strays. So what happens? The beginning of an episode. In our opinion or in our experience, we have found the presence of a female dog needs, which means the breeding cycle. There's something to do with breeding cycles. So whenever we talk of breeding cycles, usually they say in canines it is every 6 months or so, and you find that we have almost confirmed that this is a possibility. And once there is a kind of breeding cycle starts, you find that dogs move away from their territory. Dog ecology, if you see, we've also personally seen this. Dogs have territorial integrity. You all know that. You find that territorial integrity is roughly around 4 to 5 kilometers. They move out to much longer distances. They go out of their boundaries in search of a mate in order to mate during the breeding season. And this is the time when they pick up rabies or they transmit rabies if they are incubating the disease. So dog-to-dog interaction takes place at that time, and then starts the transmission dynamics, and the whole fun of rabies actually starts. Once it enters the neurons, your antibodies are not going to do much. So you can roughly calculate the incubation stakes from the site of bite to the entry of the brain by calculating the 3 to 5 millimeters per hour. This is again proved experimentally. It has been proved, and definitely we can say that the incubation period, depending on the site of bite, ranges from around 3 days to around 3 months. So it usually does. The rest of the incubation periods are theoretical possibilities. So we went about finding out dog dynamics. So we wanted to find out the number of community or stray-owned dogs that are available in Chennai city in certain important pockets of the city. So this was a physical examination done by 2 of my PG students, Dr. Pawar, Dr. Kiri. We covered 1 square kilometer area in different parts of the city where rabies was predominant. So in all these areas, when we took up and analyzed the data, we found the stray dog or community dog population ranged between 8 to 23 dogs per square kilometer. 23. These I am talking only of stray dogs. We are not talking of own dogs. So they say that 5 dogs per square kilometer is enough to sustain the disease in a population. Therefore, we need to concentrate much. What I'm trying to stress here is the stray dog populations are the most important things that help in the sustenance of rabies. So Chennai city is around 1,180 square kilometers. So roughly we should be having around 23 to 30,000 stray dogs in the city streets. Now this is another picture done by one of my students here. She found that the location of dog bite is extrapolated with the rabies hotspots in Chennai city. We find here that almost all the dog bite victims are closely aggregated towards the canine rabies hotspots towards the eastern part of the city. Now this gives us an idea that the bites are usually inflicted because of these animals traversing out of the territorial background or when these people are inside. If we had done a little more study to find out when exactly these bite victims are more, that is one thing that we have not done. We need to find out when we have a larger number of bite victims if it coincides with rabies incidents. So this is a little bit of demographics. When we did this study in the government general hospital where the post-exposure is usually done, we found that nearly about 700 post-exposure are done almost on a monthly basis. And you find here most of the bites are, you find a leg predominantly, a little bit on hand, and very few, around less than 10% on the face, which requires more severe care than anything else. And when we come here, you find that the number kind of bite, whether it is probe bite or unprovoked bite. Predominantly, it is a probe bite. Now, when the idea of probe bite is one thing that helps us to determine what is the strategy that you have to adopt in the case of post-exposure prophylaxis. Now, this is a small demographic picture that we have seen here. And the categories, it's almost the same. Stray dogs and pet dogs, both of them. That is why the probe bite incidence in the previous slide, you see the probe bite is much more than the unprovoked bite. So because there's a predominance of pet dogs as well as stray dogs inflicting bites. But this is where is the temporal distribution of rabies in Chennai city. When you see this graph, which was done in 93-2002, you find that there has been a steady rabies incidence in Chennai city. That is 93 to 2002. That's nearly about 10-15 years back. So, but you find here, the one important thing, there are two peaks. One is the February, the other is the October. Now, presuming or assuming that the breeding cycles are somewhere between June and July and somewhere between December, this peaks can be explained. Now, when the bite, I mean, I told you when you find an episode begins usually during the breeding cycle, when the animals move out of the territory and they pick up rabies or they transmit rabies. So when they pick up rabies and then come back to their territory, after 3 months, you get that peak of October. Now, again, the second breeding cycle somewhere in October, November, you get another peak in February. This is the kind of analogy that we can create with regards to this graph. Please don't think this is a very old graph. Now, this is a more recent one. You find between 2011 and 2014, again, the peak in February and October still remains. But strangely, between 2011 and 2014, you find two other peaks, one in May and the other in August. Now, this is where the epidemiological picture changes. This is a very interesting facet because whether we are doing a little more diagnosis more severe, or whether the public awareness more, they identify these dogs or things like that can happen. But you find that the February peak and the October peak still remain. Now, this is much closer, 2016. Again, the February peak remains. October peak is still there, though reduced in number, but the May peak still remains, whereas the July-August peak comes down. So every time you find the rabies positives are slowly declining, no doubt, that's a very good sign, but the peaks still remain. It almost confirms our theory that the breeding cycles have a very large role to play in the transmission or sustenance of rabies in a stray dog population. Distribution of rabies in Chennai city again is the same, but I have put this to find out, to tell you. If you see in February, out of 21 cases admitted in the isolation wards, you find 16 of them are positive, roughly around 60% or so. Whereas in March, it is a little more higher and starts to decline, again starts to increase somewhere in July, August. So our percentage, what I'm trying to tell here is our perception of clinical rabies is much higher during the peak seasons, whereas in the leaner seasons, our assumption or presumption of rabies is a little lower. So this is where we need to prune up our clinical acumen for rabies. This is the latest one, 2019, very kindly shared by my friend Dr. Potin. Again, here we don't have that October peak, very strange. Again, there is a reduction in rabies incidence in Chennai city. But you find that there is one in the June and July peak. June peak is still there, and you find that in December you don't have that peak. Maybe this is for only 1 year. We don't get that clarity. But the June peak, there seems to be a much higher one in June. What I'm trying to tell you here is, my friends, you find that rabies is endemic. That's the first point. The second point is there are two classical peaks occurring in February and October. And the possible reason could be, unless confirmed, much more epidemiological data. Possible reason as of now is the breeding cycle issues. Now, this is one thing that I wanted to bring out in Kullam district. Now, this is one of my students who did PG diploma under me, Dr. Retd. Now, you people will be much better positioned to know what is this situation. Kollam, I think Kottarakara has the highest number. And this is for our PG diploma thesis that you presented. And here, the next thing is when she gave me this data in her thesis, again we find the peaks are there in February, one in May, and the October peak is always there. So even in Kerala, the situation seems to be the same. So holistically, we can come to the conclusion that there can be a link between the breeding cycles and stray dog rabies course. So far, we have finished the temporal and spatial distribution of rabies in Chennai city. I hope I'm on track. Should I go a little more faster, or is it okay?
It's okay, sir.
Thank you. So now we go to the vaccine responses and vaccines. Now there are several vaccines available in the market. Of course, the nerve tissue vaccines are no more used. When we were students, we are supposed to give the nerve tissue vaccines. We were supposed to give the sheep brain, 5% sheep brain, 10% sheep brain for large animals, and 5% for small animals. 7 days the person has to come, and we had to give that. And humans for post-exposure received 14 days. This is just for historical information you people have to know. And then we went on for the avianized vaccines, the chick embryo vaccine we were using for some time. And then came from the 1980s, we had this cell culture vaccines. Till date, they are the most remarkable vaccines that we are using. And inactivated, of course, cold chain has to be maintained. If you wish to put it into your pocket and go, please do the vaccination before 1 hour. That's the most important thing. Oral vaccines are now becoming a little more talked about, but I personally don't know how effective it's going to be or how useful it's going to be, because it is the most important thing. It's a live virus vaccine, and we need to wait and see for the results. Recombinant vaccines are also, but the cost factor, etc., is so very high, because the cell culture vaccines are far more of greater utility. I don't think these two vaccines are going to be even though they're going to be more of a kind of an experimental exercise rather than application oriented, is my feeling. Maybe it can be better. It's up to you people. Now, on the right hand side, you have a dog image and you have an yellow arrow. When you see that, a clinician would first think of what kind of clinical sign. To the best of my knowledge, any clinician would think it's kind of a pyoderma. Ladies and gentlemen, let me remind you, this is one of the worst adverse reaction to canine rabies vaccine in dogs. So if you give a canine rabies vaccine, and then you see this kind of lesion 2 to 3 months later, whenever you see this kind of lesion, you better ask the owner whether there has been rabies vaccination earlier. So this is an adverse reaction to canine rabies vaccines. This is what they say. So when you see this, it can be a pyoderma, but to rule out whether it's canine vaccine reaction, you please ask this question. Now, a simple antihistaminic or a DEXA would be sufficient to treat this condition rather than treating a case of pyoderma. Now, this is what is known as vaccine-induced vasculitis, where the superficial blood vessels engorge themselves and produce this kind of reaction in response to the inactivated vaccine parts in a vaccine. So this is for you to just keep in mind. So when we give the vaccines are in plenty, almost all cell culture vaccines. When my student Dr. Bharati did this work, out of 180 animals that she's examined, seroprotection levels, you all know, 0.5 international. 88 of them had good seroprotection levels. Whereas in the unvaccinated, there was, of course, no seroprotection. But in the not vaccinated animals, insufficient. That's obvious. In unknown history, there were 3 animals which were insufficient, but 9 animals which had. Therefore, the history was not possibly correct enough. You see here, the information here is in vaccinated animals, the seroprotection levels are quite high. Again, in vaccinated animals, the seroprotection levels in 66 animals were not sufficient. That is why I keep telling there's a lot of difference between vaccination and immunization. See, when you vaccinate, when you inoculate the antigen, when it goes in, produces the antibodies, that is known as a successful immunization. When you just take it, you puncture, and your finger becomes wet after immunization, you find that the vaccine has not gone in. That is a vaccination, but it is not an immunization. Therefore, most of these insufficient titer or protective level in the unvaccinated animal, in the vaccinated animal 66, possibly it was not immunization, or animals would have been quite old enough, they would not have responded, immune response would have been poor. These are the various attributes with regards to the improper vaccination. So when we talk about seroprotection levels, when we saw the interval of vaccination, that is 1 to 3 months after immunization, we find that the protection levels in 80% of the animals were very high. When it crossed 4 to 6 months, the protection level came down to 50%. So as the interval of immunization goes down, you find that the protection level starts to come down in the animals. But one important thing or one interesting thing that we saw here was up to 3 years. Up to 3 years, you find the protection level is available in 30% of the animals. That's a very interesting information, because nowadays there are vaccines which are supposed to produce immunity for 3 years. So every year you need not immunize an animal against rabies. So here this study tells you that we need to have a rethink on the kind of immunization schedules that we can think of, or the appropriate vaccines that we can think of. So every year you find, let me tell you, when an owner brings a dog, immediately purchases a dog, he or she is very much interested in taking care of it for the first 6 to 7 months or even 1 year. After that, even many of the owners, they tend to
Excuse me, sir. Sir, you have muted yourself. Dr. Gunaseelan, sir, please unmute yourself. Sir, you can escape you can end the slideshow from there, and you can come back to your Google Meet tab, and you can unmute yourself. Can you see that, sir?
Is it okay now?
Yes, sir. Yes, sir. It's fine.
When did
Please
this happen?
continue. Just 10 seconds before.
Oh
I told you
God.
right there.
Thank God. So what should I do again? Go back?
Yes, sir. Yes, sir. It's visible now. You can go to slideshow mode.
Okay.
It's fine, sir.
Should I go to the previous slide or?
No, sir. You can start from the next slide.
This one?
Yeah, this one. This one.
Okay. So as I was telling now, these are the occupational hazards that we face with technology. Okay. So this is what I'm trying to tell you. After about 7 to 10 months, you find the protection level comes down. Possibly our people do not really come for the annual immunizations. That is why we need to have a rethink on the duration of immunity vaccine. It has a longer duration of immunity. But here, this interesting point that I wanted to share was 3 years. Even in when the interval immunization is 3 years, there are some animals which have a protective titer. Now, this again will tell you why I'm stressing on this is the immunization part is the most important thing as far as rabies control is concerned. And I wish to tell you this is the biggest challenge in ending rabies. A very big challenge as far as rabies is concerned. Strategic immunization and regular immunizations. So here you find the seroprotection levels with regards to age. In the 3 to 6 months age group, you find 37% have a protective titer, whereas 62 do not have. Insufficient. But as the age advances, fortunately, you find that there is the seroprotection levels are much higher in the 1 to 3 years age group, in the 3-5 age group. It means to say that people possibly protect the animals against rabies after 1 to 3 years. Possibly. That's the reason why this thing happens. They do not start that mandatory 3 months vaccination, many of them. So as age advances, they come to know and then they start immunization. Strangely, another interesting facet here is in the greater than 10 years, when immunosenescence actually happens, when animal does not really respond to vaccine, you find that 42% of very old pediatric cases are having the same kind of protection level as 7 to 12 months, which means to say possibly we are having a very good titer even in old animals. So we need to have a very broad thinking with regards to the immunization patterns or schedules for rabies. So this is based on titer, of course. Majority of them do not have a good enough titer. This is devised by the ELISA that we did. And they say that, as I told you, the impact of vaccination. So as you increase a strategic immunization of the canines, particularly the stray and community dogs, this will help you to reduce the incidence of canine rabies as well as canine mediated human rabies. Now, this is actually a clinical once a dog is bitten or an animal is showing clinical signs of rabies, we normally bring it down to the UR. Once it's diagnosed, I just take a few seconds of this, if you permit me. This is our under observation for rabies case. A slight drop jaw condition, salivation is there, but the dog is showing slightly paraplegic reactions, and you find vacant stare and all that is there. The dog is still active, it is still not gone into the comatose conditions, and this was positive for rabies. So we have a complete picture. We have a complete set of videos on the diagnostic aspects of clinical and laboratory diagnostic rabies. If you are interested, Serene, I could send it across to Prajit for you can go through it if you want.
Okay, sir.
Now, this is one important thing that I wish to tell you. Now, this is a dog, a good-looking German Shepherd dog. This was also diagnosed and put into UR. But fortunately, after 10 days, it did not really develop any signs and it was discharged. See, that is why I keep telling we need to have a very clear opinion on clinical rabies. Many of us sometimes make mistakes because of just the owner's anxiety levels. And that is the reason why we may put it in, because a provoked bite is not that important when compared to an unprovoked bite. And another thing, as far as clinical rabies is concerned, in my opinion, they say the furious form and the dumb form. In our observation of many rabies cases inside the UR, we found that this overlaps. The encephalitic form overlaps with the dumb form. So, but still, there is varied opinions on this. Because furious form, because the brainstem and cerebrum, and the paralytic form, spinal cord main. In our experience, we saw that there was an overlap between the two. I possibly think that when the virus is multiplying in the limbic system, it provokes the furious form of rabies. And once the multiplication is not at its peak, the animal starts to, and during the terminal stages, when the virus starts to move away, it moves away from the centrifugal force towards the periphery. And that is the time when the paraplegic conditions start off. Because we saw these conditions were not demarcated in many of the dogs that we saw. So this clinically, we need to know that both of these forms can overlap too. That is why we developed this algorithm. So based on this, we can make a presumptive diagnosis of clinical rabies. We have got a scoring condition here, and many of our clinicians are exposed to this algorithm, and they found it very useful. And you find that the age of the dog, you take into consideration health status, duration of illness. That is why I keep telling, whenever you find a dog suspected for rabies brought to you, there are certain things that we need to ask them. Whether it is the vaccination status of the dog which is bitten and the animal which delivered the bite, the kind of bite, place of bite, the provoked or unprovoked bite, and when did it bite. If the person comes for a post-exposure and says the dog was bitten 10 days back, and if the dog which is bitten is quite normal, then it's not rabies. So these are the various things that we need to ask before embarking on a post-exposure regimen. Now this is an algorithm which can help you to really establish the presence of clinical rabies. In our under observation for rabies isolation wards, we found that many of the dogs died on the second day. So some on the third day and fourth day, very rarely on the 10th day. You see here, the most important thing that you need to understand here is the course of disease in rabies is 5 to 7 days. Virus is excreted in the saliva 3 days before the onset of clinical signs. Now, this is the reason why we put them under isolation for 10 days. Assuming that the virus is excreted 3 days before the onset of signs, plus the 5 to 7 days of course of disease. That's why we put them in 10 days. Now, most of our dogs which were admitted to UR were the first and second day. Now, you see, if it is first and second day, that means I told you the course of disease should be 5 to 7 days. So that means this dog would have been outside the territory for nearly about 5 days earlier. It could have been outside. it could have bitten a lot of people. It could have passed on the rabies. So we need to, this is an information which we need to pass on to owners and people who are really caring for dogs in the community sector. So this is a diagnostic protocol that we take up, anti-mortem diagnosis. So we tried this. We are not recommending it, of course. In rabid dog, this is a very classical rabid dog which showed a furious form, as you call it, and we collected the saliva and to confirm the diagnosis by FAT, and it showed very positive fluorescence. But this is not a very recommended method for people to really, because it's highly risky. And here again, we have also come out with a video of postmortem diagnosis where you search for the negri bodies in the tissues. And collecting the brain, I think we have got a video on that also. You need not open the skull and things like that. You can go into the intraoccipital foramen and collect the hippocampus. I can share the videos if you want to Dr. Prajit later on. And coming to the spillover rabies. Whenever we talk of canines, I mean, we talk only of rabies in canines. So we don't really think about the other animals which can develop rabies because of dog bites. We had a horse here and a calf and things. We have got videos of these animals also, which can show clinical rabies, which may be of useful. But here in India, I don't know whether we have really vaccines licensed for pre-exposure in large animals. But of course, some companies claim that can be given. But in large animals, we don't give a pre-exposure, usually only post-exposure. They try here. That's a different issue totally. But there are certain, in Western countries, there are vaccines for pre-exposure in large animals like horses, cattle, sheep. Now coming to this dilemma. This is the most important dilemma that in rabies. Should we attempt a post-exposure in our animals? Even if you don't want to, the owner insists on this. Many times, this picture will tell you, well, what kind of, how should a dog wear its pants? So this is a $1 million question. And even for this, we have developed an algorithm where the scoring system can help you to design. Like I told you, when a person comes for a post-exposure, the questions that you need to ask is whether the bite was a provoked bite or an unprovoked bite. That's the first thing that you need to know. Because an unprovoked bite usually is suspected for rabies. The second thing, the vaccination status animal which has been bitten. So if the animal is protected, then nothing, not much to worry, because it should not. It's a concept of immunization totally. If the dog which bites this animal, if it is vaccinated, then you need not worry at all, because that animal is also protected. And we must, next question that we are likely to ask is whether you find the kind of bite, the place of bite, and when did it bite? Like I told you earlier, these are the questions that we need to know before we embark on the possibilities of post-exposure immunization. But India, remind you, is possibly the only country which practices post-exposure immunization in our animals, including large animals. Sorry. And this is the scoring system that we have devised. Why I wish to tell you that post-exposure animals, these two articles will tell you they are very circumspect about adopting this on a field level. Never the under field conditions, close observation of the treated animals is very important. If, for example, if your animal has been bitten and you administer post-exposure immunization, now if how long does the virus wait at the site of bite? Nobody really knows. There are, like I told you, there are theoretical possibilities. Supposing the virus were to enter the neurons and you start the post-exposure immunization, the first immunization will help you to develop antibodies somewhere around the 7th day or so. By that time, the virus is already entered into the neurons, it's not going to be a much help. Therefore, the animal will start showing signs after a couple of months. And then you cannot tell the owner your vaccine is protected. So it's always better whenever you have a post-exposure immunization, if you attempt it, whenever you do it, please ask the owner to be careful, observe the animal for at least a minimum period of 3 months. Don't tell him the post-exposure will definitely prevent rabies in his animal after a death. So that is these articles are evidence enough for that. Now, again, this is done by CDC. By around the 7th day only, you find that the antibody will be produced. By that time, if it goes into neurons, it's going to be very difficult. What are the failures of PEP? The washing the wound. This is, of course, in humans, and the same thing has to be followed in animals too. Please remember, the SN regimen that we follow for post-exposure in humans is not really recommended in the case of animals too. We are following it based on these two articles. And these are the class 1, class 2 bites that we have, and this is why the post-exposure regimen is practiced. These are the several post-exposure regimen schedules in humans, of course. And we follow the 5-dose SN regimen intramuscularly for our animals too in post-exposure, which I'm not really in favor of. 70%. This is what is recommended by WHO, OE, and things like that. Many of the people say if you put 70% of the animals, which 70% they are not known, whether it's owned animals or whether it's the stray animals, I would prefer you need to work on the 70% of the stray dogs. If you are covering, possibly you can help to eliminate rabies by 2030. Now, this is a small hope for people who have developed rabies. Dr. Rodney Willoughby, in 2004, this girl, Diana Gazy, she developed rabies, and there was a lot of treatment schedules given by this Dr. Willoughby, who devised this method known as the Wisconsin protocol. They produced a therapeutic coma in the girl and induced a lot of antivirals and anticonvulsants. For a minimum period of 14 days or so, they were trying this. This girl came out of the coma and recovered completely from rabies. That the principle behind this treatment was to put the brain under comatose stage, almost like brain death, and cheat the rabies virus into thinking that the patient has died. This was the whole concept. Unfortunately, this therapeutic protocol has been tried nearly about 40 times, and only in about 7 cases it has worked. So, for information of all of you, therapeutic schedules in rabies are being taken up in a large way. Very recently, also, they have induced attenuated rabies virus into the system under the assumption that the blood-brain barrier will be compromised. So, the main reason why antibodies cannot enter into the brain is because of blood-brain barrier. And they are attempting to compromise the blood-brain barrier and induce the peripheral antibodies into the CNS to protect against rabies. Now, these are all far-fetched ideas which are still going on. But now, basically, the idea is beyond prevention only. So, we need to recognize the problem and devise programs of strength for in the national interest. So, of course, One Health is going to help us collaborate with each other. Public information or extension work should be very, very important. And above all this, sustainable follow. Mass vaccination, mass vaccination, mass vaccination. Everything is mass vaccination nowadays, but we really don't know how many of these animals have been protected. So if you have a zero protection map in areas where mass vaccination is taken up, that will help us to follow and give us an idea of how far rabies is present, how far protection is there. So therefore, ladies and gentlemen, we need proactive strategies, not reactive strategies. Oh, today rabies is there, let's all go there and vaccinate. So that should not be the strategy. We need to have long term. That is why they say, whenever you take up intervention protocol, take it between the breeding cycles, not just after the breeding cycles when the rabies cases are very high, then you go into a reactive mode. And the most important thing, we need to consider on vaccines which give longer immunity than the annual vaccinations that we normally take up. So, ladies and gentlemen, I think we are coming to the concluding part. So, like I told you, this ambitious project of the WHO, OE, and FAO, I keep on telling it's ambitious because I'm not being pessimistic, but the challenges are going to be very high. So, this quote is very, very simple. Challenges are what makes life interesting. Overcome them makes life meaningful. In the Malayalam translation is there, I guess. And I wish to quote Mother Teresa, let us not wait for leaders, do it alone, person to person. And that is the whole objective of your International Veterinary Students Association. So together we can win the point. So I finally concluded, looking forward to your advice, help at this old age. You can give me more tips, you can guide me, you can assist me on this topic and whatever. So I have, now that the floor is yours, Serin and Co. Thank you, ladies and gentlemen, for patiently listening to this talk.
Thank you so much, sir.
Okay.
Now, thank you, sir. Now we'll begin the interaction. If you have any doubts, please feel free to ask. He has agreed to answer a few doubts. You can also type it in the chat box.
Sorry, there are a few questions in chat box. I think you can read that out.
Okay, sir. Mr. Srikumar has asked, in my opinion, Tamil Nadu doesn't have a definite breeding cycle as there are many overlapping cycles all through the year. Does that change the dynamics?
Yeah, that's what our gynecologist also told me when I showed them this graph. So even in West Bengal, there is an article on this. You find there is no demarcating cycles. But one of the experts in dog breeding told me the entire thing is now changed. So definitely the dynamics should be changing. That is why I told you the first graph, there's a lot of difference. When you go towards 2016, the graph is changing. So you find there are several peaks. So therefore, but what I wanted to stress was it is only during these kind of cycles that are going, overlapping cycles, that the dog moves away from its territory and possibly picks up and comes back to its own territory to spread the disease. So this is the dynamics of rabies spread, and these breeding cycles play some sort of part in this sustenance of rabies.
Yes, so that was a question posed by our Srikumar sir from Wildlife. And thank you, sir, for participating here.
Srikumar, very nice. Thank you, sir. Srikumar. You are able to hear me?
Yes, sir.
Yes,
sir.
sir.
Okay, please.
So there's one more question from Srikumar sir. What about non-canine transmission of rabies, like cats, and how important are they in this picture?
Canine cat rabies is supposed to be more dangerous than dog rabies, they say, because cats have this ingenious habit of hiding and biting. And second thing, the shape of the skull is backward and forward or something. The jaws are so shaped. If you see a dog's mouth, it is 90 degrees angle, whereas in the case of a cat, it is more drawn towards backward. So therefore, when it bites, it's usually inflicting a third-degree bite. Whereas in the case of a dog, it can be a second-degree bite. Whereas in the case of a cat, it can lead to lacerations. So cat bite is much more dangerous. But fortunately, what happens is cats, they say that they are much more cleverer when dealing with, when coming into the presence of a rabid animal. They're able to kind of sense it, and the escaping attitude is much more better than the other animals, including humans. But the cat bite is there, but we have not come across it. Fortunately, we have not come across it because it's much more dangerous.
Thank you, sir. So there's one more question from Dr. Boone Alvin. He's asking the vaccination of stray dogs against in and around forest fringes. Okay. He's asking whether it will be scientific option to curb the disease passed into the wildlife counterpart.
Naturally, it should be useful. It should be useful. The interface can be protected to a large extent. But you see, along the borders or along the forest fringes, when you do it, you must do it at least around 40 kilometers from the fringes. See, like your FMD, it's always better to go at least covering the territorial integrity of these animals. So I told you the territorial integrity of a dog is roughly around 4 to 5 kilometers. So you need to cover up to 4 to 5 kilometers along the fringes, not just covering the fringes alone. So it should definitely help. in these such kind of endeavors, it's always better to go in for vaccines which are long-standing immunity. Maybe 3 years immunity kind of vaccines are much more better.
Right. Thank you, sir. Sridhar asked a question like, what is the best suggestion for tackling street dogs?
That is $1 million question. And you see Western countries, why they don't have stray dogs. Very simple. I think they say there are 3 laws there. One is either you adopt them or put them in a shelter, and the third thing is euthanize them. These are the 3. But here, I don't know what is the laws does not permit all that. So it's the better, I think, a stray dog. We need to learn to live with it like coronavirus.
Okay, sir. Right. Sir, Sharath has asked a question like, we hear a lot about non-canine reservoir for rabies, like mongoose, etc. So such menace, how can we control them so that rabies may not propagate in the domestic animals?
So, yeah, see, mongoose, monkey, and all these kind of wild reservoirs, you find like Dr. Boone was suggesting, it's mostly the interface problems. So it's better that once you protect it's all dog mediated only. They don't get it just like that. Like for example, your tuberculosis in bovines in UK is from that badgers. So like that, it's purely 99% from dog mediated. So the first option would be to protect the canine population. And as far as mongoose and things like that, it will not be very cost effective in order to take up these challenges. We do not have, fortunately, we do not have very high incidences because of other wildlife reservoirs. And any of these bites from these wild animals, whether it's normal or abnormal, they are usually categorized as a 3rd-degree bite. Even a small bite is categorized because these are all wild animal bites.
Thank you, sir. Sir, yeah, so sir, apart from the doubts, there are many messages which are coming like beautiful presentations and all. Yeah. So one doubt which was asked by Franco is how much amount of inactivated cell culture vaccine should be given to a large animal following post-exposure bite?
Who's asking that question, sir?
It's a BVSC student, sir, Franco.
From name.
Franco.
Franco, if you listen to my talk, I am personally against post-exposure in animals. Okay, that's the most important thing, that because we'll be giving a false sense of security to the owner. If once the virus has entered into the neurons, it's very difficult. That is why this eclipse phase, some people say cell-mediated immunity will take care at the site of bite and things like that. That is why we are going for post-exposure in animals. So if cell-mediated immunity is going to play a large part in destroying the virus at the site of bite, then we need not go in for vaccination at all. You see, throughout the world, nobody recommends post-exposure immunization in animals for the very simple reason it can give a false sense of security, first thing. And the second thing is, in countries like Brazil and things like that, they have pre-exposure immunizations for cattle. That's what I told you. There are no licensed pre-exposure vaccines for cattle. And what they do there is, it's 2 ml they give at 3 months apart, 2 injections they give, and the immunity lasts for only 1 year. This is, I'm talking about pre-exposure. Post-exposure, I'm not very sure whether we should attempt it or whether if you give it, whether it will be protective. I'm not really sure on that answer because I'm not for the theory of post-exposure.
Thank you, sir. Sir, Sonavara has just wanted to, wanted you to throw some light on the national control program on rabies in India.
National control program on rabies. Now, for the current, I think NCID has got programs on rabies. There are several NGOs combating rabies through immunizations, but there are too many now we have here. I am not very specific, but the most important thing is this OE, WHO and this thing. they are ready to collaborate with anybody who wants to take up a program in eliminating rabies. That's what I understand from them.
Right, sir. Sir, there's another question like how far is ABC program helpful in curtailing this transmission?
Very sensitive questions are there. So,
It's
and
asked by Sahitya Rajamohan.
yeah, Sahitya Rajamohan, see it, if you see it from a technical point, it can reduce the population of dogs. That's the very idea. I think the Jaipur formula, I have gone through that article, and it was everything. If you take up a program, it should be sustainable. But when it has to be done continuously over many years. Even these mass immunizations that we talk about should be done at least for a minimum period of 10 years. Then only we can see the results. We cannot see overnight results, and sero mapping is very important to find out what's really going on. And your birth control programs seems technically a very feasible idea, but you need a lot of. It's a great challenge because it has to be done over work on that or results on that. I cannot really tell you how much effective it has been. The Jaipur formula is supposed to be very successful.
Right. So thank you. So I think probably the last question which I can see here is, yeah, okay. So you're just concerned over the fact that many veterinarians are not taking rabies vaccination in spite of knowing about danger of rabies. So how is the scenario there in Tamil Nadu and other states as per your high?
Yeah. So you see, we normally in Tanuvas, I think around when the students enter into the 4th year, we normally give them the vaccine. The Department of Veterinary Public Health arranges for that. And then serum monitoring was also done for some of the students, and most of them took up the vaccine. It is definitely essential for veterinarians who are dealing with animals, particularly canines. I would generally say anybody who's dealing in farms as well as other places, it's better to go for a pre-exposure everywhere. So let them not take it lightly.
Yes, President Pradyum had a doubt like, what is the opinion of immunoglobulins over vaccines?
Immunoglobulins or vaccines? Yeah.
Vaccines.
Is it for animals?
Probably, sir.
Oh, so see, even for humans, it is not available in plenty. So if you are going to go in for RIG, that is rabies immunoglobulin, along with your vaccine, I'll be very happy. And then I will recommend post-exposure. That is the post-exposure prophylaxis. And you know, equine rabies immunoglobulin, human rabies immunoglobulin, there are two here. So equine rabies immunoglobulin is given, I think, 40 international units per kg body weight. I think the same thing can be followed. If you are fortunate enough to get ERIG for animals, I would be very happy to see that you can follow it up along with vaccine. So you got to instill into the wound as much as possible, and then give the remaining on the same opposite side of the bite. So when you do this, then possibly it can be more meaningful. The post-exposure can be more meaningful as it's done in. But in humans itself, getting a ERIG or HRIG is not that easy. It's only available in premier hospitals.
Okay, sir. Out of curiosity, I would like to know that what are the places where we do now currently this protective anti-rabies titer assessment? Previously, we used to do in our lab also, but now we don't have that kit and all. But in India or in South India, is it done in Tanvas? And if it is done, whether are there any charges for that, or is it for free?
Usually the zero protection levels are done using the RIFIT. I think
Yes,
that's it. I think ISLU in microbiology in Bangalore, he does it. I think they have fixed a cost for that. But I would suggest you can go for the ELISA platelet kit, which is equally accepted. OE also recommends that you can use it, but it's a little costly, I think. what we can do is you can pool the samples.
Right.
That's much better way of getting this. Results are very quick also. It's qualitative, but it's very good. We used to pool the samples and then do it. So that's one way of getting over the problem of refit, because refit is a very, very sensitive and difficult test. Not many labs would be able to do it just like that. I think Nemans does it, I'm very sure. I think you can ask Dr. Islor in Bangalore. I think he is also doing it. So we can get from them, but definitely the cost is very high.
Yeah, thank you, sir. Because we used to get a lot of queries like when whether it is done over here, because we did it previously for free for the
For export problems and all. No? When you are transporting dogs to other countries, they require post-vaccine titers. So in such kind of things, it is very useful.
Right, sir. Thank you. So now I'll call upon Serin. I think the most of the doubts have been cleared. Yeah, Serin, please.
Thank you so much, sir.
Serin, just there are some of my students from Nigeria is there. I think Dr. Yuguda. I just like to wish him. And there are many of my students. I think they are also here. I saw Dr. Sri Kumar, Boone, and things like that. Very happy gentlemen, ladies, and who have come here. And I must thank Serin for this opportunity. And it was a wonderful event. Hopefully, you go from step by step up. There should not be any looking back, Dr. Serin and Dr. Prajit. Thank you. And if you need that CD, I could give it to Prajit. You can share it. We have developed it in the Department of Public Health. Thank you.